Before starting the physical assessment of the patient, you first want to get an overall generalization of their health. The first thing you can ask them is why they came to see you today. You can ask them what the chief complaint is. Then after that, you can ask them whatever their complaint is. Ask them how long the pain or the circumstances are going on. Then you can ask them also, what does it feel like? What does the pain feel like? And all that. Then also, you can follow up with asking what region of the body. You can ask them if it's from the left side, the right side, or if it's on both sides. And then you can ask them the severity of their pain. You can ask them on a scale of 1 to 10, 1 being the least pain in their life, 10 being the worst pain in their life, of what the pain feels like. Then also you can ask them the timing, when they receive the pain. Is it after long walking? Is it in the morning? Is it at night? During the middle of the day? You can ask them anything along those nature. And then also you can ask them what they think it is, because maybe they have a better history of their own selves than you do. So you can ask them if they've had this before or if not. Then also after that, you want to ask them if they have a past, or you want to ask them about the past history of the event, or if they have any family history of the event that is occurring. And also after that, you can ask them if they have any major surgeries, injuries, and then if they're allergic to any medications. Alright, so the first thing you want to do when washing your hands is get the water on. And then you want to add some soap. Then you want to scrub your hands. The friction is what causes the bacteria to get off your hands. Friction is the #1 cause for the bacteria getting off your hands. Once you scrub for a little while, then you want to place it, moving your hands from the top to the bottom. And the water flows from the top to the bottom off your hands. So the bacteria flows off your hands in a nice gentle way. So you want to do this, you can sing the happy birthday song a couple times, or just wait for about 30 to 45 seconds in doing this. Also while you're doing this, make sure you get underneath the fingernails so you can scrub there. And just make sure you just get a nice overall clean of the hand. So after you do this for a little while, sing happy birthday, the water is flowing off the hands into the sink. Then you want to get a paper towel and dry off your hands. Make sure they're nice and dry. Put that in the trash right here. And then also get the other paper towel, wipe off a little more. Clean up the area around you. So now we're going to take the patient's temperature. The normal ranges for temperature is 96.4 to 99.1. So the first thing you want to do is ask the patient have anything hot or cold to drink in the last 30 minutes. So anything hot?
No.
All right. Next, you want to make sure you turn on the electronic temperature. So turn it on. You want to make sure 0 is out, and make sure you have it on Fahrenheit because that's what we're using. And then you want to make sure you put a plastic covering over it so we don't pass bacteria. So put that on. And then you want to ask the patient to open his mouth up wide. Please open up. Lift your tongue. Then you want to place the thermometer underneath in his sublingual pouch and ask him to close his mouth. You want to hold it there until the thermometer goes off. Beep beep. So you ask the patient to open his mouth. He opens up. Pull it out. He has a 97.6, so he has a normal temperature. Alright, so now we're going to check the patient's height and weight. So first you want to have the patient come over and step up. Before they step on the scale, you make sure the scale is calibrated, so you want to make sure that the line is already parallel. We already calibrated before this, so it's parallel. Then ask the patient to step on the scale, facing towards the wall. And then you want to move the bottom 50 to 150. Then you want to move the top one, which is single weight, single pounds, and then you want to move that into the line is parallel on the side. Alright, so it's parallel, so you ask the patient to step off. And now we're going to check the patient's height. So we're going to extend the ruler on the top. So then you want to ask the patient with the back towards the wall to step up. Then you want to lower it. So stand up nice and tall. Alright, then have the patient step off. And you want to read the inches line on here. So for him it's 67 inches, so he is 5 foot 7 inches. Now we're going to take the patient's pulse and respiration. So the first thing you want to do is get the radial pulse of the patient. So you can grab that by going down the thumb line, little pocket right here. You can feel the patient's pulse. Then you want to ask the patient to place his arm across his chest. And then what you want to do is take this for 30 seconds. You want to times it by 2. Now 30 seconds has passed. I got 30, so he is at 60. We times that by 2. And what else you're checking for when you're doing this pulse is also you're checking for a regular or irregular heart rate. So you would just document that as regular. Also, you're checking about the force of it. It was a +2. It ranges from +3 to 0. 0 being no pulse at all, +3 being really, really fast, really, really hard. And then also what you're checking for are spongy or hard veins. And right now he has spongy veins. So next we're going to check for respiration. This is the same thing. You want to do something. You don't tell the patient you're doing this. You can just do it. And also, after you do the 30 seconds of pulse, you can just keep your hand here and don't tell the patient, and just watch his chest expand for 30 seconds. Now, 30 seconds have passed. The normal rate for an adult is 10 to 20. He had 9, so we would times that by 2, that's 18. What else you're looking for? Is you're looking for the symmetrical expansion of his chest. So he has normal expansion. Also, you're looking for labored breathing if he's hunched over, breathing hard, or also if he's using his accessory muscles to breathe. And so he's doing pretty well. He's breathing on his own. So now we're going to take the patient's blood pressure. The first thing we're going to ask them is any caffeine if they smoked in the last 30 minutes.
No.
And also you want to make sure the body position is correct. You want to make sure the arm is at heart level, that his feet are uncrossed, and he's sitting up straight. Next, you want to make sure you have the right cuff. So first, you want to make sure this covers 40% of his upper arm, which is from his elbow to the top of his shoulder. So that covers 40%, so we're good there. And also, you want to make sure that it wraps around and the Velcro is covered by 80%. So we'll do that as well. It's covered by 80%. So now we'll line up the blood pressure cuff. You want to make sure the artery marker is in the brachial artery, which is located right here. So you put that on, put it on there. Not too snug, but you want to put it on there. So we'll clip this down here so we can read it. So now I'm going to just talk you through what we're going to do. So I'm going to place my stethoscope on his brachial artery. I'm just going to hold it. Then I want to but I want to palpate his radial pulse, which is right here, which we got earlier. So what I'm going to do is, when I'm doing this, I want to inflate the blood pressure cuff until I can no longer feel his radial pulse. And I'll look at the meter, and I'll inflate it by 20 more millimeters per mercury. And then once I get there, I'll slowly release the cuff. I'm listening to my stethoscope on his brachial artery, and when I hear the first sound, I'll make the note of that sound and where I saw it at, which is the systolic pressure, and that's when the artery is opening, and that's the first when the blood is rushing through. And at the end, when I no longer hear a heart sound, that is this systolic pressure, and that is when the vein and artery is completely open. So we'll go ahead and do this. So first, I'm going to make the beak out of my stethoscope. So there's the beak. I want to use the diaphragm side, so I want to check it and make sure it's right. You do that by lightly tapping. So one. Place this in the brachial artery. You might hold that one right. Alright. So I want to get his radial pulse. Alright, I feel it. So now, this right here in front of me. So I feel it. So now I want to inflate it. Okay, so now I'm going to slowly release it. So after doing that, I got 122 over 82, which is it's a little pre-hypertension because it's between 120 and 140. But if you get a reading like that, you can opt to do it again on the other side, or you can just ask him if he usually has high blood pressure or anything. So usually high blood pressure, sir?
No.
Have you done anything strenuous in the last hour or so?
I forgot on the right here I have a Red Bull.
So he has been having a Red Bull here, and also he did a long drive here, so typically his blood pressure will be high.